arrived here at 6 a.m. this morning and had to first of all change my clothes out and take on the persona of someone who lives on the street day to day.
I've been here for 17 years. I call Prince Albert my home. For me, it's like I want to walk in their shoes, really understand at least a little bit of what they go through to improve our understanding of the challenges that they face. Simple things in life that we take for granted, like even jacket, clothes, being warm.
This is a way for me to have a first-hand experience with, just what that is like for people and where the shortcomings and the gaps are.
I'm not a person that likes to just talk, even though I do it for a living. I really want to take action and see if I could make some sort of a difference with this challenge.
I'm going to be an 18-year-old lady who's into her second pregnancy, and she's left her home because of some domestic violence. There you go. I'm about 5 months pregnant.
I know that having this experience is going to help me in my role as an MLA to go into the Assembly and advocate for change and improvement.
This is real. This is what people do every day.
What the naloxone does is it has a greater ability to bind to those opiate receptors than what opiates do.
We were learning about people that if we come across in the next 36 hours that they are struggling or have overdosed, and how to help them.
Making sure that their mouths are covered though in case they do vomit or spit or sputter.
The first challenge that we literally just did, I couldn't even get the needle off the thing to save somebody, and I am a healthcare professional. So wow, that's pretty shocking.
All right, everyone, if you want to follow me, we'll get started with naloxone training.
I'm an old man and I've got an education, I have a house and a job and all that sort of stuff, but I learned a bunch of stuff in there that I didn't know. It just seems that younger kids are finding it easier to get their hands on stuff that can do so much harm. What crosses my mind a lot is, are we teaching them what they need to know? Like I learned in there that we probably aren't.
Could a health teacher, for example, in their health class, decide, I'm going to teach you about what you need to be aware of right now?
I think the issue is expertise, and that can become a very large liability issue.
Yeah.
Has anybody actually done the cost benefit on putting these types of services in place?
The lifetime cost of the medication is $1.2 million. So preventing one case of HIV by handing out a needle will save
$1.2 million.
Wow.
In that room of 10 people, the only people that had used them were the doctors. I think it's in the public interest to reduce harm. Otherwise, we wouldn't have laws like seatbelts and helmets. Is this not in the public interest?
I think it's humbling to walk the streets of Saskatoon knowing that people do this every single day. I mean, I felt the stress, and I've only been doing this for a few hours. And then to have a doctor tell me I should get an HIV test? I mean, just that, the blood pressure just starts to go up. That's not good for baby either.
Yeah, it's definitely a good idea to get tested in pregnancy because it can be transmitted through pregnancy as well as birth and breastfeeding.
Imagine if I was this person in real life with a baby, an active user, and presumably had not had protected sex. Not only would I be terrified, what would I do if I was positive?
There's just the one little dot at the top there. That's that control I was talking about, but no second dot, so this is a negative result today.
Okay. Yeah. If I'm already dealing with feelings of shame and unconnectedness, then to find out that I have been responsible for hurting my child, I can't appreciate the terror that I think I would feel if this was me today.
Door right there, at the very end of the hall. I think part of this is now we're gonna separate you guys a bit. So Brittany and VG, you guys will go with Megan to hospital for a prenatal assessment.
So Port told us what services they provide. They can help me with transportation. They can help me with a housing application. They brought us to the hospital just to get some prenatal workups done. You feel so vulnerable. And I think like as a labor and delivery nurse and somebody who asks those questions all the time, like you try to be sensitive about it. You feel vulnerable because your belly is exposed. You see people that don't have a place to sleep that spent the night here because it's cold outside. There's so many of them living with HIV, living with COPD, living with endocarditis. Kindness is everything. The interactions that we have with patients make such a huge impact on them.
So we walked to the Hope Health Center to see a doctor. And when we got to the facility, there was a letter at the front desk saying that the office is closed today. In that letter, it stated that you could walk over to Walmart to see if they would be able to help. Adding another 30 blocks onto the walk to get there and maybe find out that they can't help would be something that the homeless population probably deal with on a daily basis. The unknown of where they're going to be next, if they can get that help at that next facility that they're going to. Can't imagine living life like that. I think it's, definitely a tough thing for me to understand because I've got a beautiful home and a beautiful secondary property at the lake, and it really kind of makes you think about the stuff that you have, and you have to be grateful for what you have. But it also makes me feel almost like I shouldn't have all of this if these people have nothing. We need to see a change in people's mentalities on understanding that basic needs need to be met, and everybody deserves that.
I mean, we're downtown quite often, but you don't necessarily look at it with these set of eyes, right? We got KD, tomatoes, loaf of bread, oats, bottle of water, half a dozen eggs, Jim Jam. Save that for me.
How are you going to eat all that?
Yeah, that's a good question. I don't know how I'd eat this. Yeah, it's great that, yes, we got this, but the roadblock is exactly how are we going to eat it. I don't know how I feel about that. I got to think about that. Yeah.
Each hamper is about 2.8 people per hamper. Well, can be upwards of probably 10% of the population in any given month. Even what you see on the shelves right now looks like a bit of food. That would be gone by tomorrow noon. And it wouldn't be enough, but we still have more pickups to do in the morning. So, every day we're kind of replenishing.
We're asking the people from the community to do this for Sanctum Care Group. And I think it's important for me to stay grounded in what we do. I hope I've changed. I don't think I've done enough. The people here have big hearts, and it's good to see. I think a lot of people think that Prince Albert doesn't have services or doesn't have enough services. Certainly the resources here are less than Saskatoon, but the needs are just as great.
We're serving an average of 480 to 500 households every day.
10,000 people who live off the food bank every month. I thought it was maybe half that many. You can only use the service twice a month. It's just a tide you over type of help. For somebody that's really struggling, it's not gonna do a lot, right? But it's something.
Can come in whenever it works for them, so some will come back to back when they know that it's going to be a tougher part of the month for them. We don't ask questions, we don't judge, we just want to make sure that they go home with food that they can eat.
Okay, so what time should we come?
Thank you so much. This makes me feel very good.
Okay, we'll see you. Thanks, Al.
Okay, so Evan, you are? Phones are hard to come by, and for people who need to make those medical appointments, that's a real obstacle.
My assumption was that there are so many support services that it would probably be easy to find the solutions to the challenges. That's not really the case. It's actually just an overwhelming amount of information. I spent the morning trying to find income assistance while not having an ID, all while my partner's 5 months pregnant and expecting, and I just keep thinking, if this was November, how brutal would this be?
So we finally just made it back downtown from deep in West Flat. By the time we got back, it was after 5. So unfortunately, a lot of the businesses were closed and we weren't able to do a few of the tasks that we had left. One of the other ones that we had was actually to make a phone call. And we knew that this was on here, so we've been trying to get quarters kind of throughout the day. Earlier on, somebody had given us a toonie. We're like, that's awesome, but we need to make quarters out of it. Stopped in the Midtown, saw a machine, put the toonie in, it gave us a couple loonies. We had stopped and talked to a lady, and she had given us 4 quarters for a loonie. So we're like, perfect, we've got our quarters, finally. The task that we were given was to call mobile crisis. And so we go to put the quarter in, and it says, please insert 40 cents. Put another one in, please insert 35 cents. But when this happened, I was like, are you fucking kidding me? Like, I've went through all of this, all of these stops, and now this fucking machine is not gonna take my quarters. I think about if you're somebody who's actually in that crisis mode and you are at the point where you're about to kill yourself and you're trying to seek help, I think that would be the tip of the iceberg when you actually try to reach out and you aren't able to receive that care.
Right now we're at Saskatoon Crisis Intervention Center. It is one of the fastest ways for people to get help. They man they man the suicide hotline. They take calls after hours of other agencies. So when people call the Crisis Intervention Center, they're at the lowest point. It's sad that they have to make that call, but I'm really glad that there's someone here to pick up that call.
That was my biggest worry in this challenge is just, how do you cope with all these unknowns, right? Like finding even supper tonight. We looked at each other like, I have no idea. I think people that do this every day have a lot of strength and resilience. It's being able to get through things that are tough and just continuing on. It's a lot discouraging, actually, to be honest, to realize that this is someone's day.
When you're homeless and you're living on the streets, oftentimes you don't know what your sleeping arrangements are going to be to the very last minute, which is why we wait to the end of the day to deliver your sleeping arrangements for the night. Where could a team or...
You have won a wonderful stay at the Delta Beds. Oh, thanks, that's awesome. Shelter beds are filled for tonight, and therefore you will be sleeping outside.
You're looking nervous. Oh, we got our first outsiders.
River Park.
Are you?
Yeah.
Outside, guys.
Brief and social detoxing. That sounds fitting. Perfect.
I knew it. I had a feeling the whole time.
I did get to sleep at the Salvation Army, but I did have a shared room with another person who I don't know.
So I'm going to give you guys 2 separate forms. If you don't know this part, it is fine also. But this part, we need some basic information about it. Like I said,
In my day-to-day life, I'm used to sleeping in a very comfortable environment with my family. So sharing a room with someone I don't know makes me a bit nervous. It's very controlled though. People are buzzed in, buzzed out. At least I get to rest for a little bit, but I don't think I'm gonna sleep much. You know, I think making things better is very multifactorial and starts really at the grassroots level. And a lot of us think that addiction causes homelessness, but it's actually more that homelessness causes addiction.
The day has been so emotional, knowledgeable, overwhelming. We knew we had to get to a place that we felt semi-safe. Dumpster diving, that was interesting. Looking for your bed in a dumpster, that was very humbling that people do that every day. When I needed a break, kind of had to go, ah! They let me. People need hope. People need facilities that we were so lucky to see today.
It's been a long day, but we saw a lot of good things, and so we'll see how tonight goes. People do this every day for years straight, and this is just a small snapshot, and this isn't right.
I think we're missing the mark, though. I think we're missing understanding how we got here and what it's going to take to see us through. That the idea that having a roof over your head and food to eat are the only things that are essential for humans is just not true. Without that connection, without that feeling of belonging, People are going to continue to struggle, and what we're learning is that we're all connected. It's one thing for me to be in that position today and tomorrow, but it's quite another to imagine that this is actually the day in the life of that goes on and on and on.
When I opened the envelope and saw that I was coming to the Emergency Wellness Center, it kind of took my breath away for a second. I wasn't expecting that, and it was definitely a little bit out of my comfort zone. I work with the community a lot. There have been concerns from the neighborhood with regard to the Wellness Center. I think those things affect you, even if you don't think they do. Yeah, I had to process that for a minute.
My partner Cody and myself, we were told that we were going to be spending the night at detox. You know, we're sleeping in a dormitory style environment with the lights on because the nurse has to come in and make sure that people are breathing and doing okay throughout the night. So we were fortunate to be able to sleep inside. You know, at least we had a warm bed to be in. I did feel a little bit like I was treated like a criminal, to be honest, because I had to give up all of my personal belongings, and once you go in for the night, you wouldn't be allowed to leave again.
Being in a wheelchair is really hard. You learn very quickly the mobility issues that people face, even things as simple as a 3-inch curb where the sidewalk is broken. It really takes a toll on a person. When you hear things about accessibility and the challenges and the importance of making things accessible to individuals, wow, that was really driven home. It took us just about an hour and a half to get here. We actually got in a little bit behind after closing, but they were very kind and let us in, and honestly, the staff were amazing. They just took care of us. They really made us feel welcome, and I kind of felt at home.
Well, my partner that I was with last night, he has a walker. As you can see in the background, he's getting a little bit of a head start, so that's definitely slowed up our travel. We started off at 6:30 this morning. We're going to the Friendship Center, and we're supposed to meet there at 8 o'clock. I think he'll be lucky to make it there just on time.
Brittany's going to hand out your Friday challenges so you guys know what you have ahead of yourselves for the day.
Yeah, honestly, I've got to a point now, I don't even care about eating right now. I just want to kind of do my challenges. I can go without the day of eating, like, to be honest. I know the Salvation Army will have sandwiches or some sort of food, right? It's just too much of a hassle to carry around anything with, you know, cans and the bag and the walker. You spend enough time doing it where you don't really want to carry anything. Making a mess over here. You know, before this challenge, I would think that there'd be cans everywhere. In reality, trying to keep an eye out anytime you could see cans or bottles, it was a different story. All of that work to walk 1 hour to Sarkan in some pretty nasty wind, it was a 2-hour round trip. All that for $8.45, let alone the hours of collecting the cans beforehand. It just really makes you realize, you know, what somebody might have to go through in that situation.
So do you guys know anything about HEART? No? Okay, so we're the HIV/AIDS response team. We have a lot of shame with our HIV status. We also try to normalize that as much as possible.
There's a lot of celebration with this as well, and so clients will be like, tell me about my blood work. What does that look like today? Those are incredible victories.
Right? Because it's exciting for me to be like, somebody who was scared and traumatized and stigmatized, they can now control that disease and it doesn't run their life.
We went and visited the court program, meeting with such dedicated people on the front lines, delivering program to the most desperate people in our community.
Every time that you're connected to a new support, you're telling that story and you're reliving those traumatic experiences. The point of our program is to get them to that point where they don't need anybody in their lives, right?
They give people the ability to believe in themselves, and they stay with them until they're ready. And to me, that's priceless.
They recommend a minimum of a 6-month stay at Kindred Spirit, but they can stay for up to a year. If you still haven't been able to find housing, you can stay until you find housing, and they will help you with that.
Sometimes family units are forced to decide who gets to go with mom.
Correct.
So out of your 6 kids that are in care, you and your ministry worker might pick 3. How do you pick 3 out of your 6 kids?
I see the faces of both my babies, and just having imagined you can't take both with you. I would almost prefer any other choice in life, to be honest, besides having to decide which kids come with me.
Right now we have a mom whose baby was apprehended at a younger age. She has no relationship with the baby. She wants it, but baby cries when she comes to her. So is that in baby's best interest to just, and mom knows that. She says, I want a slow transition because this is what's going to be best for me and my kids. Sometimes the parents haven't had their children maybe for a year, right? And to now be like, here's 6 kids, go be a parent.
I'm thankful that those kind of programs exist. Maybe a parent who's in a situation that can't have all 4 of their kids or all 5 of their kids, they can start with 1, they can start with 2, and they can work their way into getting all 3, all 4, all 5 of them back. Hopefully it's the inspiration, it's the motivation that they need in order to work towards what they need to do.
So we were given $695 each, and this is at $700 plus all utilities, which for sure is going to be $300 or $400. Like, what about food? Let alone anything else. And I get to sleep in my bed today. And a lot of people have to sleep here.
I've driven down these streets just a handful of times a year, typically as I'm driving through to somewhere else. You see the people on the streets and you maybe see the signs of the buildings, but I've never spent any meaningful time to understand the circumstances that brought people there, or even the programs that are being provided, and understand why they're necessary. We went to the Sanctum office and we were learning about some of the assistance programs. You just start to realize that a lot of these things they have good intentions, and there's a need to have processes and procedures, but at the same time, for some of the people who don't have the same access as what many of us take for granted, where do you even start?
We start from the basics so they can come to us with no income, been homeless for several years.
So she kind of walked us through the help that they do. And then through that, we went over to the library and we accessed some of the listings that were posted online, trying to find a house to look at or an apartment to look at.
We've had sort of 3 experiences with finding a place to live. One was a corporation that's got 2,600 apartment spots in the city we can't really access because we can't prove income. The second was sort of the Kijiji scattergun approach, where we made a couple phone calls within our budget. The direct response was, we don't rent to people like you. And then the third option, which is the only option, is what we just witnessed.
Tour through the house, I was just blown away. I was shocked at the conditions that people were living in. And the offset is just trying to reconcile in my mind, realizing that that's an upgrade.
I was really just shocked at the conditions that my fellow citizens have to live. There's somebody making $2,400 a month of other people suffering with public money. I guess I don't understand how public service can allow this to happen. There has to be somebody that's willing to invest in these people, not just the taxpayer, because if it's just the taxpayer, you get this usury abuse of the system.
A lot of the people that I met doing the good work were once the people who were being helped. So there's a lot of lived experience, and seeing them give back was pretty emotional.
Everybody should take the opportunity to really dig into their community and see what the challenges are.
I definitely come from a past experience, lived experiences of addictions myself. I really didn't see a future for myself when I was living through those addictions. Being on this journey helped me remember the things I have to be thankful for.
It was awesome to see the big impact of a small act of kindness. And wouldn't it be amazing if we all took those opportunities? We have to understand what every single individual needs and work together to meet that need in the community. And it's going to be hard work, but it's so worth it.
They have a lot of services here, and there are a lot of good people here doing their job. And I think when we stereotype and say that there aren't services, I think that hurts those people who are working every day to do their best to serve this population. And I'm hoping that this challenge can help them to carry on.